Let's move on then, please, to the next paper, which is Patient Voice, and I'm going to invite Tim Kelsey to introduce it. Tim.
Thanks. As we've already said, transparency is one of the core operating principles that this board agreed to when it started, and the other fundamental is participation. Is a very deep and profound engagement with patients and citizens in relation to the services that we are providing. Just if I may, the paper, obviously I'm sure everyone's read, but just to pull out some highlights from that. So we start with transparency, and last year, looking back, as we hit this moment of anniversary, as it were, we can reflect with, I think, real pride on the way in which we have made transparency real in our health services. And an example of that would be the fact that for the first time we published last year detailed information about individual surgeons in 10 different specialties. And that's provoked a really big change in the attitude of many professional associations to the importance of transparency and sharing information about their quality, the quality of services provided with patients and with colleagues. As a result of which we now have a number of other professional associations who are wanting also to share that data in public. And this year we'll be publishing 13 specialties, or 13 specialties will be publishing their data in public at individual doctor level, which I think is an outstanding credit to the professions, to the clinical professions. On top of that, we now have more than 30 audits. These are databases managed by clinicians that are publishing data at unit level in public in a way that everybody can access. Machine readably would be the technical definition, and that's for the first time in the world. There is no other country that provides that kind of resource for research, for service improvement at all. So again, a really important commitment from the NHS, health and care as a whole, towards outcomes and towards transparency. Care.data is also, of course, part of that movement, the intention to create openness and indeed a new currency of outcome measurement in healthcare. I was just going to ask Kieran to say a few words about that, but just ahead of him speaking, just to point out to colleagues and others on the live stream that Care.data is a really profound and important initiative to try and provide resources to doctors, to patients, to researchers that enable them to develop services appropriate to local need. And the first part of that was to try and link data from general practice with that from hospitals. And as you know, we decided to delay the implementation of that scheme because there was just too much concern, both in the professions and in the public, about what it was all about. And as it turned out, an inadequate level of safeguard provided by the system for the use of patient data. So I'm delighted to be able to confirm that this last week the House of Lords confirmed some amendments to the Care Bill, which mean that Parliament has now agreed to a new series of safeguards for patients' data. Again, I think unprecedented, certainly in this country, if not in the world, and we now have a basis on which we can proceed safely with offering patients real value from their data in a way that we can be completely transparent about. So that's the first point. And the second point I was just going to make was that we've also decided, in consultation with a wide number of stakeholders and colleagues, that the right answer for Care.data is to test it. So we're going to be phasing the rollout in order that we get it right, we get the information resources right for doctors and for their patients. We are very clear about what the purpose of the programme is and so on. So I think those are really important steps forward, and I just will hand over to Kieran just to say a few words.
Yeah, well, if you remember the last meeting, I was asked to chair an advisory process, I suppose, really, which we decided subsequently to have two bits to that. The first one is really around national organisations who've been engaged with this for the last while. And the first thing to say, it's really a thank you to everybody who's been involved in that, and to say that everybody has been incredibly constructive about this. No one's saying the idea is a bad idea. Everyone is saying we have to implement it really well with appropriate safeguards. And what's great is people have been putting an awful lot of time into doing that and doing that properly. Hopefully, speaking for all the stakeholders, I think lots of approval around the phasing idea, testing it, making sure that this works in reality, and that the processes we put in place around that first phase and those pilots need to be testing the real robust safeguards. And not saying that everything is perfectly safe, it's saying that it has to be as safe as possible, and it has to also to be really responsive to people's needs. So I think that's one. Second one is engaging patients and patient organisations in the scope of care.data, so that people actually understand what's included, what's not included, what should be included potentially in the future, and that transparency as well extending to what is data being used for, who's using it, and what's the benefit, and that the first and foremost benefit needs to be around improving care for the community. Long-term research is a number 2, and any benefit to UK PLC is a number 3 or in the distance, and being clear about why we're doing this and what's in it for me, really. The bit that hasn't happened yet is making sure that the process we put in place isn't just for those national organisations, and it doesn't only take place in central London inside the M25. So we are going to run a series of events around England, asking practice managers in particular places if they'd like to come along and say how does it look from their point of view, patients saying what are their views, and anybody else who wants to come along. So we'll be kicking that off hopefully between now and the early autumn. Hopefully have 4 or 5 events around the country. But the key message I think is having all the stakeholders in a room with lots of good insight, lots of good critique, lots of good challenge, but everybody's been constructive, which is great.
Well, thank you, Kieran, and for all the work you're doing on that. Before Tim proceeds with the rest of the report, can I just pause and invite any questions or comments about care.data?
A question, actually. I just wondered, we in our early discussions, the idea of having a kind of public report on how the data is used on an annual basis. Yeah. So I don't mind my data. I think care.data is fantastic, but the idea that I get some kind of report that says this is how it's been used. Yeah. Are we making progress with that? Is that something? I
think the advice, consensus, seems to be why wait annually. Be as close to real time as possible. Put the requests up before the actual approvals. Yeah. Publish at least maybe quarterly as well. So absolutely.
Okay. So the requests are going up, and what they've been used for, in the sense that the benefit is going up. Yeah.
Thank you.
Okay, so just quickly moving on, we point in the report to the programme around patients in control. This is the transformational initiative to try and give patients more convenient access to digital services, particularly in primary care. And critically, this is about meeting our mandate obligation that by March of 2015, any patient, any citizen who wishes it can get online access to their GP record for free, obviously, in a way that's going to give them value. And we have, as the report describes, done a variety of things to make that happen. We've now negotiated, I think, successfully with the software industry that supports general practice to a whole range of new standards to enable this to happen. So I'd like to thank them for their cooperation. It's been an important conversation. And a very important part of this, and one that's raised with me a lot, is if we're going to, as it were, introduce the digital 21st century into the NHS, how do we make sure we don't leave people behind when we do that? This very important question of inclusion, and we've worked in partnership with a social enterprise called the Tinder Foundation to develop some new thinking around how we can improve literacy, digital literacy in communities where there is real challenge. And just to remind people around the board, there are 11 million people in this country who are not considered literate in digital services. It's a very large proportion of our community. So we are going to support over the next year 80,000 people to learn more about how they can get better access from computers and so on, mobile telephones in relation to health and so on. So that's just to bring people's attention to that. And in a similar relationship, we yesterday announced a very important initiative with the Secretary of State to provide some additional funding to hospitals, other service providers in the NHS to really get them thinking about how they can get their own services to be more interoperable and more digital. A very important incentive, the Tech Fund, £240 million now being offered to organisations to demonstrate a commitment to the digital future. Quickly touching on Friends and Family Test, a very important initiative to give voice to patients. We talk a lot about it. We are actually doing something very tangible to make that happen. More than 2 million people have now volunteered comments on local services, and this has galvanised nurses on the wards, clinicians in general, to really get on in real time and make changes. You can see some of the examples in the document. I'd like to just bring to the board's attention the fact that that now rolls into general practice in December. I think that will be a watershed moment for the system. I think people will start making choices. I think there will be a really dynamic new currency introduced into healthcare when people can see what other people say about services that they're receiving. The patient experience becomes central to the way we do things, and also that staff will have an opportunity to express themselves in the same way with the introduction of the staff Friends and Family Test that starts this quarter. So the board will no doubt want to see how that develops. I hope for the next meeting I'll be able to bring you back some preliminary data on that. The report also touches on a variety of initiatives to give people real control in other ways. Personal health budgets, for example, I think is a very important opportunity for a certain group of people to take quite literally financial control over their own circumstances. We've already seen in the research that's been done real impact on the way in which people's lives are being improved through just greater autonomy and empowerment individually. We are now committed to providing people with the right to ask for that facility if they suffer from a long-term condition this year, and later this year that they have the right to have it. So these are really big infrastructural changes, quite honestly, and we need to work with patients to make sure that they maximise the value of them. I think finally, just to bring to a conclusion and perhaps hand over to Victor briefly, we have also, as NHS England, spent a lot of time working corporately to try and make sure we are accountable to the citizenry of Britain or England in relation to decisions we're taking, and this an initiative which Victor, Kieran and I have been working with many other colleagues. NHS Citizen is an attempt to try and think differently about how real involvement is made tangible, and I'd quickly like to thank some of the social enterprises that have supported us doing that. This is run independently of NHS England, although we are obviously very involved in it. So Involve, Public Eye, the Democratic Society and the Tavistock Institute have all been absolutely critical to the development of a new way of thinking about engagement. We all felt that, I think, at the Expo. It did feel like a new spirit had been unleashed into the room, a new energy, as it were, a new conversation. Victor, perhaps you might like to say something about that.
Can I say something about that and ask you a question?
Of course.
If I may. I think you've said pretty much everything you've said. I think NHS Citizens, we are at a stage now where we have developed a fueled cell. It is amoeba-like and it is growing. It is very different from the way people actually around this table do business. At the Expo, we made it clear this is not the growth of committees. There is no chair. There is the design process, which is inclusive of the patient citizen, and they are willing. What we discovered at the Expo is that they are willing and able and wanting to have a conversation, not an argument, a conversation with the NHS about how services, how they experience services, how they want them to be designed, and actually a shift of power, which was evident in that exercise. That is growing and rolling out. If I had a concern, it would be that the culture of NHS Citizens is, I mean, the people that were at the Expo, senior people, I think were excited and really engaged with what was happening. My concern would be that culture process is driven into the culture of NHS England. In other words, it is embedded within how we do things internally, because otherwise we have this fantastic growth of engagement, involvement, and then they hit a brick wall because we carry on doing what we've always done. The question I wanted to ask was really around the digital inclusion. Shall I just say, I thought your report was really, I just read all the stuff that's going on. There is a door being pulled open, and I wanted to acknowledge how hard you'd worked on all this. I think it's fantastic stuff, really. When you talked about 11 million people that were digitally illiterate, for want of a better term, the 40,000 programme that you're working on, I don't know, I can't do the maths, but it's 0.000 something. So the question I was going to ask you is what is the scalable intervention? Because these people are at the very sharp end of the inverse care law, and if we're not careful, the pace of change will leave them even further behind.
Yeah.
So we're going to have something which is rapidly expansive in this cohort of people? And 40,000 is a good experiment, but what's the scalable? Are we thinking about the scale?
We are. It's a really good question, and I'm beginning to have conversations with local commissioners. This is a local issue. I'd hope that a local commissioner in their planning will be saying how do we empower our communities for a variety of different reasons, and critical to that is that they don't leave people behind. I think we're talking about how we kind of build that into the way in which we how we stimulate that conversation locally. I think there's a limit to sort of the national intervention here, but we should be encouraging local commissioners to think seriously about that. Yeah. Can I just say just finally, very finally, that if people do want to get involved in NHS Citizen, the website to sign up at is nhscitizen.org.uk.
Sign up.
Thank you, Tim. Moira?
Thanks very much, Malcolm, and thank you, Tim, for a very good report. I think I commented before about how encouraging it was to see the small examples of change that organisations had taken as a result of that feedback. But I just wanted to ask a bit more about the staff friends and family test. And that's being rolled out in one go. Have we? Because I think obviously they're commenting on services, recommending it to their friends and family, as it were. But nevertheless, that necessity of having some sense of impact and action being taken and fed back, have we trialled it at all in terms of their ability, organisations' ability to do that and not further disillusion staff in some organisations who may already be feeling under-supported? Have we got any evidence really of how that one works? The practical examples you've given about patients are great, but I'm trying to think about what the practical examples around staff might be.
Sure. Well, I can give you. I'll separately perhaps brief you fully on what the research has gone on to kind of get us to the point we're at now. But so there a lot of work was done in terms of looking at piloting, working with providers across the piece as to how this would best work. But we shouldn't kid ourselves that this is completely new. Obviously, it's common in many other industries. And there's a lot we can learn from though, but we are not like other industries, quite frankly. So there's a lot we need to learn. So what we said is this first year is about learning to make it really work for all parties. So there's an awful lot of sort of continuous evaluation, a big conversation going on about what it feels like, whether it's working. And I'm very confident it will work, but I'm also confident that we'll need to keep it under continuous review for all the sorts of perverse, odd behaviours that could potentially take place if we're not careful.
Yeah, thank you.
I was just going to add to what Tim was saying. Obviously, we've got the Friends and Family Test to start, but also the staff survey has important questions about the extent to which people feel able to raise.
I'm just supporting it. It's a couple of some very practical things. We've got, as you know, part of the Compassion in Practice strategy has got a whole work stream action area on staff experience, and as part of that, we are working with King's Nursing Research Unit around looking at the cultural barometer, which is specifically aimed at measuring both culture and experience of staff. And then we've also got some really good examples of staff ambassadors. So many people around the table will know of Helena Donnelly, who was somebody that was a whistleblower at Mid Staffordshire. And her role is now as a staff ambassador in Staffordshire in a trust run by Stuart Poyner. And what's worked really well there and is now being replicated across other organisations is she acts as a link between staff that want to be able to raise a concern and the board, and it's a very open environment where people can do that. And we know that that has been rolled out in other organisations, and she is in huge demand to be able to actually spread that message. So really important. And we also know there are other campaigns like the Speak Out Safely campaign that people are signing up to on a regular and repeated basis, which is giving people a bit more support to be able to do what's right and speak up and be supported to do that.
Thank you. Margaret and Victor.
As with the others on the board, I really want to congratulate you on the not just the width, but also the results that you're already reaping from the work that you've done, Tim, on this. My question is about NHS Citizen. In order to make sure that people who really want to be engaged have meaningful engagement, how do you see your work being aligned with with Karen's work on organisational design? And here, it would be really interesting to know whether, in fact, Karen is actually being asked to build in programmes for receipt of responses.
Well, I think that's a really, I think we discussed that a little bit yesterday. I think that's a really important point, and we need to find a way. We now have a whole variety of different channels. It's difficult to, in a way, capture the complexity and creativity of NHS Citizen, because it's not just a website, it's a whole series of different things. There are dozens of meetings that happen regionally and locally all the time, and so on and so forth. And I think we need to find a way of taking that energy and absolutely plugging it into the organisational stock take and review that we're doing. So that's a conversation I know that Ros and I are planning to have with Karen really quickly. And in a way, it's a great resource for us because it didn't exist before, and we absolutely owe it to everybody that we do use it as effectively as we can, but it's a good challenge.
I was just going to make a point that seems probably obvious, but I think there is a correlation between the Snowy White Peaks, the staff, friends and family test, NHS and NHS Citizens. They're not separate things, and they all point to, and I'm sure Simon has picked this up, to what we do with the leadership culture. So I'd be concerned if these things were seen as separate. They are part of the same challenge, and I would argue that NHS Citizens should be the kind of foundation, the thing that drives the culture shift, in order that the other things actually can be used properly and be learnt from. I'm sure that's an obvious point.
And just to build on that, and maybe to say it in the negative, what can't happen is that NHS Citizen happens over there, friends and family happens over there. And it's what Olivia and Giles do is the kind of the free pass for everyone else. I think this has to be embedded in how we do business. How we commission,
exactly.
How we redesign services, and
it's a big challenge.
And do joint commissioning.
Yeah,
it's all the same thing.
Karen.
Again, just reflecting on the conversation that we've had about this, I think it's a really great opportunity now to, as we look at the organisation of NHS England going forward, think about how we build this into our culture, our values, our way of working, not just as a separate piece of activity, but as something that is a part of the way that we all operate. Because if we're not thinking and acting like this, then we won't be able to build that into our commissioning and our engagement with the wider system. So your point is really well made, and we will certainly take that into the organisation work we do.
Good. Well, thank you, Tim. Can I just say how immensely encouraged I am by that conversation? I think I get a sense of traction now in joining together NHS Citizens with everything else that we do. Could I just like to ask you a question about something else in your report, which is access to medical records. And it's in your report, and you also, in your presentation today, mentioned that this was free. And I'm struggling to understand the report in the Times yesterday that some GPs are charging patients for access to medical records. Can you cast some light on that?
Yes, I read the report and was suitably downhearted. Frankly, it's the reason. Part of the reason for this is that the general practitioners, as data controllers, are allowed under the law to charge a small fee for people who wish to have access to their records. We're committed to providing online access where it's wished for by next March. In a way, obviously completely for free, and what we collectively need to work with general practice on helping it to recognise the importance of releasing these kinds of information to patients whose information it is in any case, in a way that doesn't charge. So I'm following that up, but essentially from next March that won't be happening.
So you can assure us that from next March there will be no.
Well, there are other reasons why I think GPs are charging for aspects of data, and we need to look into it. But certainly, simply for people to get access to their medical record, that will be free, and online from next March.
I think these two things go together, don't they? If you've
Yeah.
got a lot of photocopying of old brown manila envelopes,
Yeah.
that's a burden, but that's one of the great benefits of digital, that it is free and ubiquitous.
Yeah.
Right, well, on that assurance, thank you very much, Tim, for that report.